Hello everyone. Today's another Q&A video, a question about magnesium and whether we should all be taking it or not, and then also another question about basically having a tick bite, no test coming back positive, treatment not working, and what the heck can they do as a next step. So just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So the first question here, it says, regarding magnesium, lots of headlines these days suggesting many of us are deficient due to soil depletion. Are there any reasons not to supplement with magnesium all the way up to bowel tolerance for overall health? So it's a really good question. I don't think that there is a definitive answer. Because at the end of the day, while magnesium is a unique nutrient in that we're able to, in my opinion and my experience, get a really good clinical sense if someone needs more magnesium, because the idea is that if they're deficient in magnesium, they're going to be able to take a lot of it before it gives them loose stools, kind of like with vitamin C. When a person's healthy, doesn't have an infection or anything like that, like a cold or a flu, take maybe 1, 2, 3, 4, maybe 5,000 milligrams a day of vitamin C. Over and above that, most people are going to get diarrhea. Person sick with cold, flu, some kind of upper respiratory tract infection, they can sometimes take like 20 or 30 grams before it would give them diarrhea. So there's kind of this idea that, like, oh, if your body's if it really needs it, it's going to soak it up. So same idea with magnesium. So that's certainly a guiding principle that I've used in practice to find the optimal dose for magnesium for my patients. But I really, to be perfectly frank, I really generally just use that when I'm using magnesium to try to address some type of a symptom. So if a patient's constipated, they have migraines, they have tight muscles, they have restless leg syndrome, they have a lot of anxiety, they have insomnia, magnesium can be helpful for any or all of those conditions. Using the bowel tolerance rule is something that I employ in practice to try to find the right dose for my patients. And in those cases, bearing in mind that we want to be using a really well-absorbed form of magnesium, my go-to is magnesium glycinate, but magnesium malate's well-absorbed as well. Magnesium taurate, to my understanding, is quite well-absorbed, although I never really use it in practice. To my understanding, those are all better absorbed than magnesium citrate, certainly better absorbed than magnesium oxide, to my understanding. I have a whole video on, what's the best form of magnesium. I think it's like best form of magnesium for constipation. It's one of my most popular videos, like thousands of views. Anyways, popular topic, I guess. But just for, the average patient coming in who just doesn't have any of those health issues, or just for general health promotion, I'm not sure how important it is to take magnesium up to bowel tolerance, because at the end of the day, there might be someone out there who really doesn't need magnesium. They're not low in magnesium in their tissues, but maybe they can tolerate, 5 or 6 or 7 or 8 capsules because they just have really tolerant bowels. They can just handle it. So I'm not really sure. I'm usually a pretty big fan of mostly recommending supplements and treatments to my patients when there's a really obvious discernible benefit. Either, hopefully clinically there's a benefit, they have more energy, better sleep, less stressed, whatever it is, or there's some tangible improvement on their laboratory values. Their cholesterol is way too high, and so they're working with something, and now their cholesterol is normalized or something like that, or their blood sugar was too high and now it's normalized. So with magnesium, we don't really have the luxury of having an accurate blood test, again, to my understanding, that can really tell us if a person has adequate magnesium levels or not. So for me personally, if I was feeling good, which thankfully I do feel good, and I wanted to see, hey, maybe I can feel even better taking magnesium, I might try it up to bowel tolerance, see how I feel. And if I'm sleeping deeper, if I'm feeling better in some way, then I would keep taking it. But if it wasn't something that was making an obvious benefit for one of my patients, then I probably wouldn't ask them to take it on the regular. Now, that being said, in this day and age, because of the mentioned nutrient depletions in our soil, that seems to be the case. I do fairly regularly recommend to my patients that they take a good quality multi-nutrient. I've mentioned in a few of my other videos, my go-to recommendation is one called Multi-SAP by the company NFH, Nutritional Fundamentals for Health. They're based out of Quebec here in Canada. I have no financial affiliation with them. It's just very well priced, high potency multi-nutrient. So I really like that one. There is another company also from Quebec, interestingly enough, called Vitazan. They make a product called Multi Daily. I have no financial affiliation with them either, and they make a really good multi-nutrient as well. So I am a generally recommend to a lot of my patients that they work with at least a low dose of at least like one capsule a day kind of thing, like not a super high dose, but just a thank you helping dose of a multi-nutrient, which would have some magnesium in there just for good measure. But it's obviously all case by case, and it's always an individualized prescription for each patient. So thank you for the question. It's a really good kind of thought experiment, so to speak. And I don't know the answer, so could have saved us all 5 minutes of time here, me just saying I don't know. But in all seriousness, hopefully that gives some useful feedback on that question. The other question today says, I've been sick every day for nearly a year after a known tick bite. I had several CDC, Center for Disease Control tests that have all come back negative. I've done several rounds of antibiotics without relief. What would be a better test for me to do that would show exactly what is currently going on at this point? So yeah, I'm sorry to hear about your health issues. Thanks for the question. So, the challenge with CDC testing, by and large, is that they're largely going to be doing antibody testing, which is all well and good, like serological testing. It's all well and good, but sometimes with serological testing, we're going to get false negatives. It depends on when the testing was done in relation to the tick bite. It depends on what microbes they're testing for. Are they testing for all the possible species? Are they testing for all the possible co-infections? Are they looking at not just Borrelia, but also let's see here. Yeah, it says several CDC tests, so it doesn't really get into more details that, doing the Lyme test multiple times, or were they looking at several different microbes? But, when we're thinking about Lyme, we should also be thinking about co-infections in many cases. So Bartonella, Babesia, Mycoplasma, Ehrlichia, Anaplasma, and then possible viruses as well, like Epstein-Barr virus and cytomegalovirus, HHV6 virus, Coxsackie viruses A and B. So there could be other microbes afoot that haven't been tested for, and then sometimes antibody testing just doesn't work. If the testing is done too soon after the tick bite, or if antibiotics have been given before some of the tests, it can induce a seronegativity, at least to Lyme antibodies. And then of course there's just good old laboratory error. Like no lab is perfect. Not every lab has perfect sensitivity or specificity. There are alternative lab testing or additional lab testing that can be done, like ELISpot testing, which is testing for a T-cell mediated reaction to these same microbes. So sometimes that will pick up evidence of infection when an antibody test doesn't. And then sometimes it's not related to the tick bite, or sometimes, I shouldn't say that, in this case where it's like, okay, a tick bite, symptoms came on. Sometimes there's something else going on, that like the tick bite may have been the instigating issue, but it was actually causing something else that was kind of hiding under the surface to become manifest. So, one of the main things that I see that I'm kind of alluding to here is I've had many patients over time where they, get a tick bite or they get some type of infection and they're treated for that infection and they don't get better, or they don't get all the way better. And then in hindsight, we see, oh, well, they had underlying, mold colonization in their sinuses, and then Lyme came along, and that was just the straw that broke the camel's back. The immune system got all dysregulated, and then they're treated for Lyme, but they only get partially better or not really better at all. And then it isn't until they're actually treated for the underlying mold toxicity that finally had that little window of opportunity to then, kind of explode and create all these symptoms for the patient. So it's one of those things where we have to be really careful as clinicians, and I guess as patients as well. And hopefully folks are, advocating for their own healthcare and all of that, to not have, Lyme blinders on, so to speak, or Lyme and co-infection blinders on, where it's like, oh, well, if there was a tick bite and I'm feeling sick, like, clearly it must be something that was in the tick. But, sometimes it's not that simple, as much as I hate to say it. I've had patients where they come in, they've had tick bites, they have all these symptoms, and it turns out it was like small intestine bacterial overgrowth. It's like this intestinal issue, and we treat that, and that makes everything go away. And anyways, there's a number of different things that could be going on when it comes to complex chronic health challenges. So anyways, hopefully that's some useful food for thought. If that answer is not quite hitting the nail on the head in terms of the type of information you're looking for, feel free to post in the comment section below, and I can happy to kind of do a part 2 answer to this one. But I hope that you find some answers soon and that you're feeling better. And if anybody has any questions on this topic or on anything else, just post in the comment section below, and I will do my best to answer as soon as I can.